Hi, this is Paul Feuerstein, Technology Editor of Dentistry Today, and I have a great privilege today to be here with one of dentistry's top clinicians, but more important, my dear friend, David Hornbrook.
Thank you, Paul. Thanks for
Dave,
saying that.
how are you?
Yeah, it's my pleasure.
And what are you doing now?
I'm doing a lot of really cool things. I still practice, as we talked
Yes.
about, and I still love practicing clinical dentistry. I think it also brings me some credibility as an educator that I can say, you know what, I do the same things you do.
You love this.
I love dentistry, and it's so easy to continue to do things that you're passionate about. What I'm really excited about is what I'm doing with Keating Dental Arts now, which is a totally different deal for me. You know, I've had the opportunity to consult with dental laboratories and work a little bit with them in the past, but I'm actually, and I have a kind of an important sounding title, the Director of Clinical Education and Technology at Keating Dental Arts. And I think they're taking their lab to an entirely different level than most laboratories. You know, he's embraced technology, the CAD/CAM and the digital world. I mean, he's jumped right into it. And he asked me several months ago, would I like to be a part of a team that's moving forward? And this team is about educating ceramists, educating doctors, understanding technology, purchasing technology that's not only going to make dentistry better for his doctors, and I say his doctors because he has this huge following of clinicians, but also for those doctors' patients. And so it's where I'm excited is, I mean, your technology, I'm excited to be in an environment that doesn't have a ceiling.
Wow. Now, do you have a clinic set up in their laboratory somehow? Is there are there live patients involved?
Yes. In fact, we just built a beautiful state-of-the-art operatory. I wanted a TV with an HD camera that could show intraoral, and Sean went out and bought 3 60-inch TVs, and he bought this camera that'll do intra and extraoral from Germany, and it's absolutely incredible. So we have this unbelievable operatory that is also my office up there, which is kind of fun. I get to look at this operatory all day long. But we are doing courses, and we're doing over-shoulder courses, and very exciting. And as you know, I started LVI, and then I had Pac Live, and then the Hornbrook group, and these are big, very expensive courses, and dentists had to take a lot of time out of their practice. And economies have changed. I mean, you know that as well as anybody. And the demographics of young dentists, and for them to spend thousands and thousands of dollars and take 6 days out of their practice, I mean, that was
one of the challenges that Pac Live put down.
Absolutely it was. And so what we're doing now is we're doing over-the-shoulder 2-day courses where we're limiting to 10 to 15 doctors. They get to spend 2 full days with me at a very affordable price. They come to Irvine, beautiful Irvine, and I actually design a case. We do the smile design, we prep, we provisionalize, and then overnight, the Keating ceramists build this case, and the next day, we talk about materials and we talk about cementation, then I seat the case. And there's didactic information as well. Being in a format, and even though I've lectured in front of thousands of people at a time, where I like is when I have 10 people and a flip chart, and they can say, "I have this problem. How do you deal with it?" And I can say, "This is how I deal with it."
Oh, that's
it's just a really great format.
That's casual. It's upfront. It's personal.
Yeah,
that's really
and it's really fun. And I'm a firm believer that the more you enjoy something, the better educated you're going to become. And we're having a really great time.
That's great. And it's so nice to see you rejuvenated. I mean, not that you weren't before, but you're still rolling, you're still pushing.
Oh, yeah.
Energizer Bunny.
Yeah, and yeah, absolutely. I feel that way. And I love technology. And when I see these scanners and these milling machines and what they do, I think the average clinician would have no idea what we're doing now in the laboratory, how the restoration is fabricated.
That's true. There's a certain workflow that they have to understand. I mean, even if you're taking a traditional impression, you're still in the digital workflow, whether you know it or not.
Oh, yeah, absolutely. One of my pet peeves is dentists that do not fully take advantage of the expertise of their ceramist or laboratory. And when I hear a dentist say, "Oh, I got a bad result from whatever laboratory," first question I ask is, what was the communication process? If it was a lab prescription that said porcelain veneer 611B1, that's what I call prep and praying. You prep and you pray that whatever the ceramist gives you, that your patient likes. Yeah. And so I urge doctors, and the nice thing about me being there is if they have a question about a case, if they have a concern, they can call me directly, and they can send photos and they can send models, and we can interact as a team, which has been very rare. There's never been that liaison between a laboratory and a clinician. I'm this new liaison. I'm very excited about it.
That's amazing. So how do people find out more about the courses, about Keating Lab? Is there a website that Keating has?
Absolutely. Actually, we have a really nice website. It's keatingdentalarts.com, www.keatingdentalarts.com.